So the next question is, what is the infection rate from a tick bite likely to be? So this is a challenge. We really don't know. It's sort of like you ask the question, what are the chances of me catching HIV if I go to Kerry and have unprotected sex? It's very low because the seroprevalence of HIV in that population is very low. What are the chances of me catching HIV if I go to Botswana or I go to Durban, South Africa, and I have unprotected sex? Well, in that situation, up to 70% of the young women are seropositive for HIV. So it's higher. We don't have, what is the transmissibility of HIV? We think something in the range of less than 1%. What is the transmissibility of a tick infected with Borrelia that then inoculates its saliva into a human? The data are not quite clear. So I think the studies, we need better studies to be done. As mentioned, in Old Lyme, Connecticut, up to 60-70% of the ticks are positive for Borrelia. In El Camino in northern Spain, lots of Irish do a religious walk in that area, heading to a religious retreat. 40% of the ticks are positive. In Ireland, between 6 and 15% of the ticks are positive for Borrelia. But statistics don't mean anything to individuals. If you're infected with a tick, it's 100%. So people think that the infection rate from a tick inoculating its bacteria into your system ranges from 0 to 20%. If the tick's on you for 10 seconds, probably 0%. If the tick's on for a longer period of time, it's probably an increasing percent. But even a short period of tick exposure can result in Borrelia infection. So I think it's important then to understand that if somebody has a tick on them and they're from Old Lyme, Connecticut, I think it's high risk of transmission. In that situation, many doctors would recommend immediate treatment for Borrelia. If you're in an area where the seroprevalence is considered to be 6%, for example, Donegal in the north of Ireland, some people would automatically treat, and some people would say, let's just watch and wait and see if the patients develop symptoms. So there's different approaches to treat patients who have been exposed to ticks. But you should take into consideration, the tick bite, how long the tick has been on you, but many people don't know that, and how common tick infestation with Borrelia and other bacteria are in your local community. However, these studies have not been done. So longer transmission probably means more efficient transmission of Borrelia, but people are infected for even short duration of tick infestation. And then finally, like I said, other bacteria besides Borrelia can be spread from a tick bite. There's guidelines on treating, but if you treat early for Borrelia and they're infested with other bacteria like Anaplasma, like Bartonella, like Rickettsia, like tick-borne encephalitis virus, doxycycline, which is one of the recommended treatment, may not work for these bacteria. So I think it's quite important to understand that just like with sexual exposure to HIV, you can provide patients with statistics on how likely it is for an infection to occur. But we commonly give post-exposure prophylaxis for HIV, even when there's an extremely low risk of exposure. With Lyme disease, we have a different set of guidelines. And part of that is because we don't have good studies to truly understand the seroprevalence of these infections, how many ticks are infected with Borrelia and other bacteria, and we don't know how efficient the transmission of Borrelia is from a single tick bite. So lots of challenges there. And this is an ongoing area of investigation and needs better studies.